Good evening, everyone. I welcome all my viewers on this live program we are doing on Heart Mitra today. As you are aware, Heart Mitra is created for all of you, and we post a lot of information on a daily basis for all our viewers and followers so that you have right information coming to you, which helps you maintain and learn about a healthy heart. We also invite for you leading doctors from across the country who can talk to you as a friend and can directly answer the questions which you have in mind. Now, today on the same lines, I have Dr. Raghav Sharma with us, who is an interventional cardiologist from the city of Ambala. Sir, welcome to the program.
Thank you.
Today, we will use expertise of Dr. Raghav to understand little more about heart failure. We keep on getting so many chats, questions from you that what is heart failure, how it is different as compared to heart attack. So we'll learn all this from him today. But before I start taking questions from you, let me formally introduce him to all of you. He is one of the noted cardiologists in North India. Ambala is a city in near Chandigarh in Haryana. And after completing his super specialization in cardiology in 2014 from Chennai, for last one decade, he has been serving his patients in the field of cardiology. Till now, in last 10 years, he has done more than 10,000 angiographies and implanted pacemakers to almost 500 patients. He's been also awarded as Economic Times Inspirational Cardiologist of the Year in 2020, and he has many publications and other rewards to his credit. He is currently Director Cardiology at RKM Hospital in Ambala. Straight away, sir, let me welcome you and hand it over to you. You can set the ball rolling by giving us the context around heart failure, and then we will take in the audience questions as well.
Right. Thank you very much. Well, heart failure is, to be honest, is one of the most difficult as well as most, you can say, one of the most problematic disease which we come across because these are chronic patients and it adds to a lot of burden in today's era for patients who are having cardiac problems. Whether the cause may be any, it can be by birth, it can be genetic, it can be due to infections, it can be due to multiple reasons like you have underlying coronary artery disease, your vessels are blocked, the part of the heart is damaged. So it is one of the biggest challenge. And what we see in our country is there is no proper heart failure clinic so far being set up to manage these subset of patients because heart failure needs a lot of patience, a proper understanding, and a thorough knowledge of how to manage these patients, how to treat them, to follow up regularly, whether they are taking medicines regularly or not. So it's a big, challenging, and a daunting task, and it adds to a major burden to cardiovascular disease, especially in our country, and of course adds to the cost also.
I think the way you have helped us understand to begin with, so it seems that there is a lot of prevalence of heart failure, and we need to do a lot as medical community to create awareness and also create the treatment protocols and probably the more facilities around it. Sir, from patient's perspective, and since most of our viewers are either patients or caregivers, or people who seriously want to understand about more about the cardiovascular disease. Keeping it simple, I think in our country, Mr. Most of the times, people we don't differentiate between heart attack or heart failure. We feel it's all the same. So, as an expert, can you help us understand how what is different in heart failure? Does the patient has a similar kind of a chest pain, acute pain, for which we mostly see why a patient goes to a cardiologist? Please help us understand that.
Yeah. So first, let me tell you what exactly is heart attack. So if I go, let me explain you a very simple way. Now, heart acts like a pump. It pumps blood out. It takes in blood, purifies it, pumps it out. So when it is doing it, it is working constantly for throughout the day, throughout the night. So that is, it is 24/7 working. To work like that, the muscles of heart require constant supply of blood to them. So any blockage which happens in the arteries which supply blood to heart, that will cause heart attack. Now, if a specific artery is blocked, that particular area of heart is damaged. If it is not treated within a particular time window and patient is not able to reach on time, that area can become permanently damaged and it may affect the pumping of heart. The wall of heart will stop functioning and hence the pumping will decrease. So that can lead to heart failure. Whereas on the other hand, blockage of vessel can be one of the cause for heart failure. Heart failure is like the muscles of heart become weak. They cannot pump the blood uh, out. So what happens is that blood goes back to the lungs and it causes you to have breathlessness and you become symptomatic. So blockage of artery can lead to heart failure, but there are many other causes, like sometimes genetics can be a problem, congenital heart disease can be a problem, it can be idiopathic, that there is no cause, muscles weak, they can be weak. Of course, blockage of artery is one of the major cause and major problem in our country due to lack of knowledge and careless attitude of people towards their own self. So that is the difference in heart attack and heart failure. Heart attack means the vessel is blocked. Heart failure is the pumping of the muscles of the heart has decreased. That is what.
Okay. No, no, thank you for making it simple for our viewers to understand. And as Dr. Sharma tells us, if there's some blockage in the vessels of heart is not getting proper blood supply in its vessels, that is a heart attack. That is where someone will have that acute chest pain, and there would be those things. And if the capability of heart to pump out the blood, if that is reduced, that is something called, which is heart failure, and two different things. So now, for a common man, please help us understand, like, how does someone comes to know that he may be having heart failure? Because in this case, as you mentioned, that that traditionally there in heart problems, that chest pain which will happen, it doesn't happen in heart failure. So how can someone identify and then meet his doctor?
See, there are multiple ways to diagnose heart failure. Number one, chest pain is not the cause for heart failure. Chest pain can happen when there is a blockage in the vessel. Now, the point is, even if your vessel is 90% blocked, you will have a chest pain. But that doesn't mean you have a heart attack. Chest pain is one of the warning signs, whereas heart failure is very clear when you see people of your own age, when they are walking with you on a level ground and you start feeling breathless, walking after some distance, you start feeling you're tired, you're fatigued, you are having air hunger, or while sleeping in the night, suddenly you get up in the middle of the night feeling that you are asphyxiating, you are not able to breathe properly. That is a time when you need to go to your doctor, and it is your doctor will advise you with basic investigations, your x-rays, and of course echocardiography plays a crucial role in diagnosing heart failure. So basically it's more of a diagnosis which is made when the patient comes to us with these symptoms. As such, it is very difficult for patient to find out whether he is having failure. Other point which is important is if he sees that his feet are swollen and he is having swelling on the body, that can be another reason when patient may have chances ki he may be having a heart failure. Now, heart failure is of two types. One is left heart failure, and other is right heart failure. So when you have swelling of your abdomen and when you have swelling of your feet, that means you are having more of a right side of the heart failure. Whereas if you have more of breathlessness, you cannot lie down flat. You feel while you are walking, you feel difficulty in breathing. That means your left heart has gone into failure. The point is either right or left. Eventually, both will lead to heart failure. That's
Okay.
the point.
So I think one is breathlessness, which you very highlighted, I think emphasized. Another is swollen legs, feet. But sir, I mean, help us understand. Patients may, live with this breathlessness for years together, and they will ignore it. Because breathlessness can happen for various reasons. Low, people may feel it's a stamina-related issue. They've not been walking much, so therefore they are having. Are there any very, very compelling, early warning signs which a common man can pick up, that this breathlessness is not a stamina issue, but it can be a cardiac issue, and he at least then goes and meet his doctor?
See, the only difference is, see, one is called physical deconditioning. Like if you ask me today to get up from the bed and start running 10 rounds in a ground, I will get breathless in 2 rounds. So that sort of breathlessness is very different. This type of the breathlessness, what you will see in patients with cardiac failure will be when you compare those people with your own age, you will see when you are even walking normally, you will not be able to walk as they are walking or as comfortably or as fast as they are walking. Number one. Number two, you will feel more fatigued, more tired. Number two. Number three, sometimes, if, especially in patients with left heart failure, when you're sleeping in the night, suddenly mid of the night you will get up with dry cough, and you will have air hunger. You need to walk out. So these are certain signs which are very clear. You need to visit your doctor to have a clear cut diagnosis. As such, it is difficult for common people to make out difference, because, as you rightly said, even if some people may say we are physically deconditioned, so we may be breathless, and some people may are. See, India, a lot of people smoke, a lot of people have asthma, so they can also have breathlessness. So it is more or less, when you have these symptoms, it is better to visit your doctor, discuss with them, let them get you investigated.
Okay. No, I think these are very, very important points which Dr. Raghav has highlighted. I'm sure our viewers are making a note of it. Sir, are there any specific group of people, who may be at a higher risk of heart failure? Are there some common risk factors so that, those people can be a little more cautious about the situation and should not ignore any symptoms?
See, there are different. See, heart failure occurs in different categories for sure. So, as you said, for common people to understand the what are the risk factors, patients who have long-standing high blood pressure, who are patients who have diabetes, chronic smokers, or patients who have had previous history of coronary artery disease. Apart from that, patients whose family history is there. Family history plays a very crucial role in heart failure. It runs in families. Apart from that, general disorders like muscle dystrophy, some people will have, they all will have these problems of cardiac failure. So if you ask me, aged patients with hypertension, diabetes, family history, or previous history of any coronary artery disease, they should be very, very careful, and they should go for lifestyle modification and get themselves regularly checked up once a year, for sure.
Okay. And when, sir, patients, come with such symptoms to you of heart failure symptoms, so as a doctor, how do you, confirm your diagnosis? Like, are there any common tests which you do on a patient to identify it's a heart failure?
See, there are two types of patients you will get. One, you will get as a cardiac emergency. They will come with severe breathlessness. They will be short of breath. You will be admitting them. Then you will be thinking either it is because of the heart attack, patient is in failure, or other possibility is that the patient per se will have a problem with their pumping of the heart, and they would have never got checked. The group of patients are patients who will routinely come with chief complaints. We are very breathless. We cannot walk two steps, and after walking certain distance, we cannot go from our room to the washroom. Also, we feel very breathless. So in those group of patients, we routinely do one ECG and get one regular echocardiography and basic blood investigations to see the causes for dyspnea. And mostly, when we look at that, we find out either what we need to see is whether their hemoglobin is less, then also they can be breathless. Number two, ECG wise, they have underlying any coronary artery disease or they have diabetes. They can also have proper poor functioning of their heart, because diabetes have silent attacks. So you don't never know how the heart is going to behave in those subset of patients. And of course, when we do echocardiography, we are crystal clear. Pumping is very less. So the reason for heart failure in these subset of patients is because of the poor pumping of the cardiac function. So
Okay.
yeah,
So there are clearly, these
yeah.
tests or let's say the
Apart from that,
physical.
certain blood investigations are also there. But even after those blood investigation, last resort is we go to echocardiography and see the pumping of heart, how it is functioning and how it is not functioning.
Okay. Sir, I mean, looking at that, how, most of us react in our country, till the time it's not a very emergency situation, we don't want to go to a hospital or we don't want to go to a doctor. Now, in such a situation, when this acute chest pain is not happening, sometimes going to a cardiac hospital, people feel that they'll get hospitalized and, it will be a very long duration of treatment they have to go through. But please help us understand, sir, that for heart failure, does it require hospitalization all the times, or you manage the patient on OPD basis and it can be managed by medicines?
See, the problem with heart failure is it is a chronic problem. Number one. Number two, patients need to be very patient, and the medicines has to be very much guideline directed. Every medicine has a specific role in cardiac failure, which most of the people are not taking properly. So what happens is, when you are a chronic patient, you have to take prolonged medications and you have to follow your life very, very carefully. So people usually tend to miss out on that. That is the point when the problem starts, and what happens is these patients end up in hospitals, and the chances of hospitalization are very high. Reason being non-compliance, failure to understand their problem, cost of the medicine, plus patients keep on rotating with different doctors, so every doctor has their own pattern of treating the patients. So multiple factors come into play in these subset in these groups, so it is difficult exactly to figure out what exactly happens. But yes, once they have been admitted, there have been repeated and frequent episodes of readmissions because of their carelessness, no doubt.
Okay. So I think, sir, one of the intents and effort of Heart Mitra is that we spread awareness, we make people aware about their disease state early on as well. So can it be said that if a patient picks up symptoms timely, and if he's going to his doctor timely and following the advice, then he may not be required to be hospitalized, that frequently, if the treatment is started early or diagnosis is made early.
Actually, if you are very much adherent to your treatment, you are following your advices properly, you are doing your do's and don'ts properly. Usually, we haven't seen patients coming up with problems, but somewhere or the other, carelessness does happen either on the patient side, or they will miss the medications due to XYZ reasons. So it is little difficult. That is why I said it is a very big cost burden, as well as a burden for cardiovascular events, because it has to be we have to understand that cardiac failure is a treatment. The treatment in heart failure has to be, you have to be very patient in treating these patients. Patient has to be very patient, because it will slowly, eventually, patients will start improving.
Yeah. Okay. So I think he mentions to us that yes, it is important that you identify it timely and you follow your doctor's advice. That will save you from a lot of trouble. But then it's a progressive disease, and then it will keep on going on.
Coming back,
But
going,
sir,
coming, going.
yeah, yeah. Sir, I mean, for those people who where they have picked it up early and you are giving them treatment, are there any lifestyle modifications which you recommend to them, which can help them manage this in a far better way, and their disease will not progress? Do you recommend
Of
such
course,
things to your patients?
Of course, definitely. One is they should be following their doctors. Number two, the medicines should what have been prescribed should be taken regularly without a delay. Number three, the water intake is very important. As per your doctor's advice, you should follow that. Salt intake has to be very less. Apart from that, when you cannot do very heavy work all of a sudden, because body is not used to working at so low heart pumping, because normally, like for people like me who have a normal blood pumps at 60, throws around 60% of the blood to the body. So when your pumping is less than 60%, let's say 30%, 35%, or 20%, so there will not be adequate blood supply to different parts of body. So you cannot do very heavy strenuous work. Rather, start working slowly. Physical activities to be done very slowly. The body has to get used to low pumping of heart before you can perform any other activities. That is very important, because see, one of the major reasons of precipitation of heart failure is patient would have applied force, like even while passing motion or have lifted some heavy object, they will start feeling breathless, and then they will go into frank failure. A lot of patients comes with that complaint too.
Okay. All right. So and what about, so you have talked about the water intake, the salt intake, and these things have to be in advice of the doctor. What about exercise? Generally, it is said that you maintain a good exercise schedule during the day over a period of time, and that will reduce your cardiovascular problems. But in this case, a patient is facing breathlessness already. So, what's the general advice to patients with respect to the physical activity in such cases?
See, the point is very clear that as I earlier mentioned, the body has to get used to such low cardiac output. I mean, low pumping of the heart. So you cannot go to sternus physical exercises. Again, you will land up in trouble. So you have to start very slowly. Day by day, you have to build your stamina. Body has to get used to it, and slowly you can increase your exercise capacity.
Okay. So you recommend exercise or physical activity, but that's like, it has to be very, very slow and in a very graded way. This needs to
And
be done.
not like you and me going in for a gym or going in for heavy workouts or going for a high cardiovascular exercise. No, not at all.
Yeah.
Very, very slowly, under proper guidance. and then slowly, once the body gets used to it, you slow by slow increase your workload.
Yeah.
Yeah.
So I think our viewers watching us, this is very important. So I think heart failure is a unique situation which may be very different as compared to other cardiovascular events, and therefore having sticking to your doctor's advice in this case, whether it is related to diet or medicines or physical activity, it's, it's very critical that you follow his advice. Now, so let's hope that most patients identify it early. They are taking their advice, your advice as well, and they are able to manage their situation. But
Right.
now, as you yourself said that it's a progressive disease and it will eventually worsen. So, where does it go? Like, do we have today effective devices or effective medicines, which can take care of a patient even if it's a severe heart failure, and can, with someone, with severe heart failure, live a healthy and a longer life?
See, it depends again on what sort of patient. See, certain patient you have various devices. Like, let me see, medicines are one aspect of treatment, and they have to be your basic first line treatment for every patient. Once those patients are not able to maintain themselves on the medication, then you step up your medication. There are different categories of medications which are started according to the various stages of heart failure and stepped up accordingly, looking at the response of the patient. Despite of optimum medication, if you are not able to go ahead with, if you are still symptomatic, then you fall into the certain criteria. There are devices available like cardiac resynchronization therapy is there, or you have what you call that AICDs. AICD is basically to prevent sudden cardiac death. But to improve pumping, you have cardiac resynchronization therapy. Again, patient has to fit into that criteria before it works well for them. So it is not
Okay.
that the devices are 100% a cure. If you have an
Okay.
ideal patient who fits into the criteria, definitely he may respond. Otherwise, patient can be non-responder also.
So
Apart from
what
that,
what
yeah,
so
please
what
go ahead.
percentage of what percentage of patients would get can be benefited with the medicines and devices in this
See,
case?
majority of patients will remain on medicines. Devices have their own criteria based on their echo finding, based on their ECG, the duration of certain complexes. I mean, that is two technical points that cardiac
Yeah.
electrophysiologists are the right person to judge them on. And then another option is you go for cardiac transplant or left ventricle assisted devices. Then again, the waiting period for transplant is too high. In a country like India, where your immunity is not very good, you are highly prone for infections. You have to be very much careful. Apart from that, left ventricle assisted devices do come, but they are very costly. Again, so
Okay.
by and large, the mainstay of treatment is again looking at our country, looking at the major population is medicines for sure.
Okay. No, I think we have covered largely, today's subject on this, and you have been very kind, telling us about what is heart failure, what are the symptoms, how patient can himself identify earlier and then go to his doctor. And you also talked about that how important it is of early identification and timely or following of doctor's advice. Dr. Raghav also shared with us that there are medicines or devices which are available and which can be helpful to majority of the patients. Sir, anything as a final messages which you would like to tell to our viewers or patients if someone has got heart failure? So how the prognosis is, how things are going to look like for him. Can someone live a healthy and a longer life if doctor's advice and the treatment is followed properly?
See, though, as I already mentioned, heart failure is definitely a chronic problem. No doubt about that. You have to be very patient. It is sometimes frustrating. At times, you will be irritated, but you have to stick to your doctor. You have to have a strict lifestyle to follow. If you follow it regularly, take your medicines properly, follow your do's and don'ts properly, definitely we have seen good amount of survival benefits. But slight or even I will say minimum of your carelessness can put you in deep trouble in these patients. So these are very special patients, and they need to be guided every time and from time to time regarding their diet, regarding water intake, regarding medications.
Okay. No, thank you so very much for helping us understand today on this whole subject of heart failure. In the common parlance, awareness is low about heart failure, and generally people are not even able to differentiate between heart attack and heart failure. But I'm sure today the way you have simplified some of these aspects around heart failure, this will be very useful for our viewers and patients at large. But before I conclude this program, I will definitely like to thank all our viewers who joined us live today, or who would be watching this program later on as well. I think this program will stay here. A lot of things Dr. Raghav has shared, you may not fully recall. Go back, listen to him again. I think some of the advices which he gave you around, especially the symptoms, how to identify that, what kind of advices you should be following from the doctor, very very important. And once again you can hear them in your friend circle or in your community. If you have anyone who has cardiac issues, you can simply share the link of this program, and this conversation can be very useful for them. With this, we will thank you all. Dr. Raghav, we will thank you as well.
You're
If you
welcome.
are in Haryana, Punjab, somewhere in North India, you have any cardiac issues, or on the heart failure you need more advice, you can always visit Dr. Raghav Sharma at RKM Hospital, Ambala. But if you are far away listening to us, and if you get symptoms as he mentioned, please immediately go to your nearest cardiologist and seek advice and stay with advice. Thank you so very much and good night. Thank you, Dr. Raghav.